Hello everyone, today we are presenting over bladder cancer, and I'm going to go ahead and kick us off talking about the history of bladder cancer. So in 1856, the discovery of synthetic dyes was made and the commercial production of synthetic dyes had begun. This was done by an 18-year-old chemistry student named William Perkin. He was actually working on a different project which included coal tar and quinine, for the treatment of malaria, and he was unsuccessful in that project. But instead, he studied the mixture that it produced, which was compounds with an intense mauve color. He then found out through his research that could dye silk. He then started the production of this with a factory in Europe, and it continued to spread. By the mid-1890s, a German surgeon by the name of Ludwig Renn reported the very first cases of bladder cancer in dye workers. Renn had used the cystoscope to diagnose bladder cancer in 3 of the 45 workers. His hypothesis was that the inhalation of fumes during the production of the dyes then resulted in noxious metabolites, hope I pronounced that correctly, that were then excreted into the urine by the kidneys. Then that urine obviously sat in the ureters for quite some time, and that is what led to the formation of the tumor. This hypothesis continued to be proven correct, and by 1906, he found 38 cases of bladder cancer. After World War I, dye patents were seized from Germany, and the industry started to spread even more. Large companies were producing synthetic dyes, and the evidence continued to grow supporting this association with bladder cancer and the synthetic dyes. In 1920, it was then suggested that dye workers living in factory facilities, as well as their families, or even just people living in the vicinity of the factory, were to be tested for bladder cancer. This did prove there to be another outbreak. Then in 1930, a pathologist by the name of Dr. Hübner warned of a similar outbreak of these dye patients in Germany due to the exposure in or near these factories. He was then joining the cancer research at University of Pennsylvania, and this is kind of what brought that awareness of the danger of dye factories into the United States. Next, we're going to be moving on to the causes of bladder cancer. Now for the causes of bladder cancer. So bladder cancer is a relatively common type of cancer, and it begins when the cells in the bladder develop mutations in their DNA. The DNA basically contains the instructions that tell the cell what to do, and in the bladder cancer, it's telling the cell to multiply and to go on when the healthy cells will actually die. So these abnormal cells then form a tumor that can invade and destroy the body, and over time, those abnormal cells, they start to metastasize or spread throughout the body, and that's when we get into the different stages and types of bladder cancer, and that's when your doctor will help decide the best route of treatment. Next, we'll be discussing risk factors for bladder cancer. So, interesting fact, in the United States, bladder cancer is more common in men than it is in women. And then also, as a person gets older, their risk also increases for bladder cancer. So it's very important that men and older individuals specifically are doing the screenings they need to be and being aware of these other risks that I'm about to discuss. So tobacco users are at a greater risk for bladder cancer, specifically individuals who are smoking cigarettes. So tobacco contains chemicals known as carcinogens, and when you're smoking a cigarette, that tobacco and chemicals then get absorbed into your bloodstream, which is obviously filtered by your kidneys, and then that all collects into the urine, and that's what exposes your bladder to the high levels of those chemicals, which damage the DNA in the cells that are lining your bladder and ultimately causes that cancer to form. So some other risk factors for bladder cancer includes a family history, or perhaps in the workplace being exposed to paints, dyes, or petroleum products. So trying to limit that as much as possible and take the measures needed. Next, it may be a past treatment of radiation therapy to the pelvis, or anti-cancer drugs can also be a risk factor. And then finally, drinking water from a well that has high levels of arsenic or water that's been treated with chlorine is also putting you at risk for bladder cancer. So next, we're going to be discussing some signs and symptoms.
Hi, my name is Jay Nettie, and today I'm going to talk to you about the environmental factors and also public health efforts for bladder cancer. So, one factor is water pollution, specifically arsenic. Arsenic is a chemical element found in water, air, and soil. We encounter it every day. Some people aren't affected, but unfortunately, some people are affected. And some places with high percentage of arsenic in their water is India, Hungary, China, Bangladesh, and Korea. And I was stationed in Korea, so I can kind of attest. The people were great, the culture was great, the food was amazing, but the water quality wasn't the best. And we often had alerts to where we couldn't even use the water, you know, the water that was coming out of the faucet or the sink. So, yeah, the water quality wasn't the best. Everything else was great though. Air pollution is another one, and exposure to chemicals and gases, and specifically these chemicals: paints, dyes, engine exhausts, diesel exhausts, hydrocarbons, and occupations who are exposed to these chemicals and gases are mechanics, metal workers, painters, hairstylists, people who work in plant workers, electricians, people who work on the oil rigs. I'm from Louisiana, and the plant and the oil rig industry is booming. It's always been booming there, and I've always lived around an area with plants, and you can smell the chemicals and the gases in the air. So, ways to prevent exposure: if you know anyone who has these occupations, or every day we encounter it because we love to get our hair done, we love to go get our nails done. Mechanics, you need to get your car fixed all the time. It's just simple everyday things that you don't realize that you're exposing yourself to. And ways to prevent yourself from exposure is to wear gloves, wear face coverings, wear long clothing, and try your best not to inhale or ingest those chemicals or those gases. Next, we're going to discuss public health efforts. One public health effort is medical screenings. There are two types of medical screenings for bladder cancer. One is hematuria test, and the other is urine cytology. Hematuria testing is where they test for blood inside of your urine, and that's the one that most people are familiar with. But I was surprised searching up the urine cytology one because I had never heard about that one. And that's basically where they take urine samples and they put it under a microscope, and they look to see if you have any abnormal urine cells. Another public health effort is new bladder cancer treatments. Immunotherapy, I've never heard of these until now. Immunotherapy, which is where they let your body's immune system fight off cancer with the help of immune checkpoint inhibitors. And some of those immune checkpoint inhibitors are PD-1, PDL-1, CTLA-4, and CTLA-B7. So I thought that was interesting because I had never heard of this type of therapy to fight off cancer because we're familiar with radiation therapy and chemotherapy, and we all know that it can have an effect on your body, and a physical effect on your body, and also emotionally, it can affect you and your family. So just to know that there's another way that can be possibly less harmful to the patient. That's a blessing. That's a good thing. Another type of therapy is targeted therapy, and basically they target proteins that dictate how cancer cells grow, divide, and spread in your body. And some of the proteins that they target are FGFR2 and FGFR3 genes. If you're not familiar, those are two types of genes that activate mutation and they activate tumor progression. Another new cancer treatment is antibody drug conjugates. And basically, they take monoclonal antibodies, which are lab made antibodies that bind to cancer cells and they kill them. So, very similar to how white blood cells help us out whenever we're sick. The only thing is, these are lab made, and their antibodies, like I said, they connect to your cancer cells and they do their best to try to fight them off, just similar to white blood cells in our body. Another public health effort is research programs, specifically SPORE, which stands for Specialized Program of Research Excellence, and DCEG, which stands for Division of Cancer Epidemiology and Genetics. I'm all for research programs when they're done in the correct way, and both parties involved are agreeing to the research. And it's always beneficial because just constantly trying to find new ways to help defeat and destroy cancer and make it easier on the actual patient and less harmful to the body. If you've ever witnessed anyone going through chemotherapy or radiation therapy, it can take a toll on their body physically and mentally, and it could also affect their family because of financial obligations, and just also seeing your loved one physically look different, and in some cases they become weaker. And it's just always good to have those research programs that are constantly looking for new ways that are less harmful to the patient, and that way it can benefit the patient, the family, healthcare workers, because also the mental health of healthcare workers is also important as well, and seeing their patients go through certain things can weigh in on their mental health as well. So that's all I have for you today. I'm going to pass it to Gilbert to talk about his two topics.
Hi, my name is Gilbert, and I'm going to be going over the prognosis for bladder cancer. The prognosis for bladder cancer does not have one clear picture, as it does depend on how severe the cancer is when found. How they determine that is by making two grade levels called a low grade or a high grade. A low grade is when the cancer cells have not compromised the bladder or its muscle wall, and the cancer cells are moving slowly and pose a low threat to the patient. A high grade is when the cancer cells have breached the muscle wall or bladder, as well as even other organs, and worst case being distant parts of the body. Adding to that, the cancer cells would be spreading faster due to it being a high grade, making it now a severe threat to the patient. Two additional factors to consider when determining the grade level would be age and general health. Age, because as someone gets older, their body naturally gets weaker and it becomes harder to fight off any illness, as compared to someone who's young and her body naturally fights off illness more efficient. And general health, because being young or old, a good general health can help someone recover better as compared to someone who has a poor health that could be battling other sicknesses as it is, and now having to add bladder cancer could affect how their treatment and recovery goes. The grade levels, age, and general health are all important for doctors because it allows them to determine what treatment a patient should receive, as well as an idea of how a patient might respond and recover from it. The survival rate is based off a 5-year study and can change over time as new developments rise. If abnormal cells are found in the tissue lining of the bladder or outside, the percentage would be 95%. If the cancer is in the bladder only, then it drops down to 71%. If the cancer has spread beyond the bladder to other organs, it drops again to 39%. If the cancer has spread beyond the bladder, beyond other organs, and now to a distant part of the body, it drops down again to 8%. These percentages aren't the same for everyone, as it could depend on how your treatment and recovery goes. To the treatment for bladder cancer. How they determine the treatment a patient receives is based on what stage the cancer is at. They break it down into 5 stages, 0 through 4. For stage 0, they would rely on surgery because at stage 0, that means that the cancer cells have not spread to the bladder or any other major organs and could be taken out in good amounts to slow down the spread, but it does come back most of the time, unfortunately. Moving on to stage 1, they would move on to intraversal therapy, which is when they put a drug directly into your bladder rather than by mouth or injecting it through your blood. For stages 2 to 3, they would both move on to radiation therapy or chemotherapy, but only if the patients are well enough to handle the treatment due to them being very aggressive treatments. If they are not well, then they would attempt to move on to a cystectomy, which is the removal of the bladder or bits of it. For stage 4, they will stick with chemotherapy and move on to a more specific kind called systemic chemotherapy, which targets the whole body instead of focusing on just one part. For a reoccurrence of bladder cancer, they would fall back on systemic chemotherapy to stay aggressive with it, as well as over different types of drugs through targeted therapy or immunotherapy. Another type of treatment patients could receive is called palliative care/therapy, which is a non-based evidence. And what they offer to a patient is something under psychological, physical, or spiritual care. And what that means is they're helping the patients or their families through those 3 ways, giving them guidance or extra support they need when dealing with the bladder cancer, as well as helping them through the treatment or guiding them spiritually. Some examples would be if they're depressed, and they would help not only the patient, but the family member as well deal with what's going on and accepting reality that their loved one has bladder cancer, or on the patient side, helping them acknowledge that they do have bladder cancer and finding different ways to get through it, as well as any other concerns that the patient or family could have. Those would be the treatments one could receive when having bladder cancer. That will wrap up our presentation over bladder cancer. Thank you.